Good evening, everybody. I'm Dr. Amitesh Kumar Jha, plastic reconstructive and cosmetic surgeon working at RDI Aesthetics, Kolkata. Today, I'll be speaking about gynecomastia, which is a condition affecting nearly 50% of males at one point in their life. Gynecomastia is basically enlargement of the male breast due to increase in the glandular component of the breast. It has to be differentiated from a condition called the pseudo-gynecomastia, in which there is excess accumulation or collection of fat in the breast area. Gynecomastia not only affects the mental health of the patient, but has profound adverse effect on his personal and professional life. Coming to the causes of gynecomastia, the main cause is hormonal imbalance. There is increase in the estrogen level and decrease in the testosterone hormone. It thus affects three main stages in life. First is at newborn, in which there is excess maternal hormones. Second is at puberty, in which the rate of synthesis of estrogen is higher than testosterone. And third, in elderly, in which the testosterone level is declining. There are certain medical conditions like liver disease, such as cirrhosis, kidney disease, and adrenal tumors, which may present as gynecomastia. Certain drugs may present as gynecomastia as a side effects. And thus, a thorough clinical examination and taking a proper medical history is very important. Certain investigations like the ultrasonography help us to differentiate between gynecomastia and pseudo-gynecomastia. They also help us to diagnose certain lumps, which may be a sign of underlying malignancy. Coming to the treatment of gynecomastia, most of these conditions improve by 6 months to 2 years. If your condition is not improving or is worsening, you should consult your healthcare provider as soon as possible. If you can palpate a lump in your breast area, you should immediately see your doctor. The treatment of gynecomastia can be divided into medical and surgical. The use of medical treatment is very limited because of their low efficacy and their side effects. There are certain drugs which are available which are used in the treatment of gynecomastia. However, the uses are limited by their efficacy. The main treatment of gynecomastia is surgical, and with use of minimum invasive techniques, the outcomes are excellent. You can expect to have a flat chest straight after your surgery. You can join your office the very next day, and the good part of surgery is the scars are very minimal and are placed in areas which are hidden. If you have any queries regarding gynecomastia, you can send me an email or also text me or send me a message on your WhatsApp. With the use of liposuction, the downtime or the post-operative period of surgery has reduced significantly. The scars are very minimal and results are very excellent. I would also like to mention a point, a query that I am repeatedly getting about the use of exercises in treating gynecomastia. Now, if you have pseudo-gynecomastia, the use or exercising may reduce the condition slightly. But if you have gynecomastia proper, this condition may actually get worsened on excess exercising because your muscles become stronger and breasts tend to protrude more on your chest. I hope I have answered many of your queries. If you have any other query, you can send me a message. Thank you.